Good evening, dear friends. Today, we are going to dive into the fascinating and sometimes controversial world of arterial hypertension. High blood pressure is often described in simple textbook terms, but the truth is far more complex than what we usually hear in a clinic. At first glance, hypertension seems easy to understand. Your blood vessels are under excessive pressure, your doctor prescribes medication, and you're told to take those pills for the rest of your life. But is that the whole story? Could there be hidden factors that influence our blood pressure? Factors most people and even many doctors rarely think about? Some specialists, primarily younger cardiologists, strongly argue there is no connection between hypertension and the spine. For them, the heart and arteries are the only players worth attention. But there's another group, neurologists and more experienced doctors, who believe there may indeed be a connection. They suggest it's not the bones of the spine themselves, but the nervous system that links everything together. And since the nervous system regulates the tone of our blood vessels, it may play a much larger role in hypertension than most people realize. Why do younger cardiologists dismiss this? Because they rely heavily on what's written in textbooks. They are trained to see hypertension as the result of arterial stiffness, cholesterol, diet, salt, or genetic. And while these factors are real, textbooks don't always match the messy reality of living patients. In practice, many cases don't fit neatly into those boxes. Doctors who spend decades treating real people eventually notice this gap. They stop giving absolute answers and start asking broader questions. That is why practical experience matters so much. The longer a doctor practices, the more they see exceptions. Patients whose blood pressure changes with posture, neck problems, or nervous system disturbances. Instead of saying it's only this, they begin to say, maybe it's this too. One such researcher, neurologist Mikhail Petrovich Savanov, carried out fascinating experiments. He studied groups of drivers, accountants, and office workers, people forced to sit for long hours in fixed positions. He measured their blood pressure throughout the day and noticed something striking. When people tilted their heads downward, as if looking at their phones or reading newspapers, their blood pressure increased. But when they maintained a neutral head position, their pressure stayed closer to normal. This suggested that posture, something most of us never associate with hypertension, could directly influence blood pressure because tilting the head disrupts venous outflow. Blood flows into the brain efficiently but drains poorly. The balance is disturbed, pressure inside the system rises, and the body responds by increasing overall blood pressure. Other scientists, including neurosurgeons, found links between cervical spine problems, like herniated discs and high blood pressure. They documented patients with severe hypertension whose numbers normalized after treatment for spinal conditions. In some cases, the relief was so dramatic that patients reduced or even stopped medication under supervision. The theory here involves the vertebral artery and vein, which travel through the cervical spine. It's not just about the artery being pinched. In fact, arteries are very difficult to compress mechanically. The bigger issue is with veins, which are fragile and collapse much more easily. When venous outflow is blocked, blood enters the head but doesn't drain properly. Pressure builds, not only in the skull, but in the entire circulatory system. Think of it like plumbing. In a heating system, water must flow in and out smoothly. If there's a clog in the outflow, pressure builds up everywhere. The same principle applies in our body. Arterial inflow plus venous outflow must remain balanced. Otherwise, the system compensates by raising blood pressure. This is why neurologists emphasize not just blood inflow, but outflow. And it explains why posture matters so much. The common forward head posture, the one we adopt while scrolling on our phones, working at desks, or driving long hours, is one of the worst for venous outflow. Over time, this subtle imbalance becomes a constant strain on the body. There's another layer to this, the nerve plexus around the vertebral arteries. These tiny nerves regulate vascular tone reflexively. If irritated by posture, muscle tension, or cervical misalignment, they don't just affect the local artery. They send signals that tighten arteries throughout the body, so the problem spreads far beyond the neck. Interestingly, when people sit for too long in poor posture, they often instinctively stretch the back of their neck. This isn't random. It's the body's natural way of trying to relieve congestion. The long extensors of the neck are crucial here. If these muscles are strong, they support the head properly and reduce the risk of venous compression. But if they're weak, The head falls forward, flattening the natural cervical curve and making problems worse. Over time, this poor posture irritates the sympathetic nerves, flattens the cervical lordosis, and narrows the pathways for arteries and veins. The result: increased tension, venous congestion, and reflex arterial spasms. In other words, blood pressure rises. This isn't just theory. It's something you can test yourself. Take a blood pressure monitor, measure your pressure in a relaxed, upright position, then tilt your head downward for several minutes and measure again. Many people will see a measurable increase. Straighten your posture, breathe deeply, and check once more. Often, the numbers drop back toward baseline. Now, imagine this effect happening not just for a few minutes, but for years. That's why posture-related hypertension is often missed. It creeps in slowly, masked as essential hypertension, the type doctors say has no identifiable cause. We've now seen how posture, venous outflow, and nervous system reflexes can quietly push blood pressure upward. But to understand just how serious this is, let's look at what happens in daily life. Think about how many hours each day people spend with their heads tilted forward. Students bent over books, office workers staring at screens, drivers gripping the wheel, or simply anyone scrolling endlessly on their phones. This single posture may not hurt immediately, but it sets off a chain of events inside the body. Veins collapse, venous drainage slows, intracranial pressure rises, and the nervous system responds by tightening arteries throughout the body. The real danger is not in one moment of poor posture, but in its repetition. Day after day, year after year, the nervous system adapts to a new normal. High pressure becomes constant, and eventually doctors label it as essential hypertension, a condition with no clear cause. But the cause may be hidden in plain sight, right in the way we hold our head and neck. Several documented cases make this point even clearer. Imagine an accountant in his 50s. Despite taking 3 medications, his numbers refused to fall below 160 over 95. He also suffered from stiffness and tension in his neck. When he was introduced to a program that strengthened his neck extensors and corrected his posture, his readings began to drop within weeks. In 3 months, he averaged 140 over 85, and his doctor reduced his medication. Or picture a long-haul truck driver who constantly complained of headaches and dizziness on the road. Scans showed mild cervical protrusions, nothing alarming on their own. But after undergoing therapy focused on improving venous drainage and mobility in his neck, his blood pressure stabilized and the headaches disappeared. And then there's the student in her early 20s burning midnight oil during exam season. She suddenly faced blood pressure spikes her age should never have brought. Heart and kidneys? Perfectly healthy. The problem was her posture. Hours bent over textbooks, veins compressed, circulation disturbed. Once she learned to sit tall, take breaks, and practice simple neck stretches, her blood pressure returned to normal. These examples remind us that not all hypertension is rooted in clogged arteries or kidney strain. Sometimes it begins in the muscles and nerves of the neck. But how does this happen on a deeper level? Around every artery in the neck lies a network of sympathetic nerves, the body's automatic regulators. When everything flows smoothly, these nerves keep the system in balance. But when compressed or irritated by muscle tension, they overreact. They trigger arterial spasms not just locally, but throughout the body. A local disturbance becomes a global response. It's the same as a thermostat in your home. If one sensor is faulty and reads the temperature wrong, the entire heating system reacts. The house overheats, even though only one room had the problem. In our body, that faulty sensor can be the nerves irritated around the vertebral artery. The role of specific muscles here cannot be overstated. The long extensors at the back of the neck are designed to hold the head upright. When strong, they preserve the natural cervical curve and keep the pathways for arteries and veins open. When weak, the head falls forward, flattening that curve and compressing vital vessels. The sternocleidomastoid muscles at the front and sides often become tight and shortened, pulling the head further forward. The scalene muscles at the side of the neck, when tense, squeeze the narrow spaces where veins and nerves pass into the chest. Even the small pectoral muscle, often ignored, can press down on a vascular nerve bundle beneath it, interfering with circulation from the arms and head. These muscle imbalances don't just appear overnight. They develop quietly, from poor habits, stress, and long hours of stillness. And slowly, they create a hidden environment where high blood pressure thrives. Many people try to fix this by stretching, but aggressive stretching is often harmful. Pulling the head too forcefully or forcing the chin downward can flatten the cervical lordosis even more, making the problem worse. Instead of relief, patients end up with more instability and headaches. The solution is not brute force, but careful balance, relaxation of tight muscles, strengthening of weak ones, and restoring natural alignment. This is also why mainstream medicine often overlooks the problem. Cardiologists focus on the inside of vessels. They are trained to look for plaques, narrowing, or clots. Their tools, ultrasounds, angiograms, and blood tests, show what's happening within the arteries, not what's pressing from outside. Neurologists and physiotherapists, on the other hand, are used to thinking about posture, muscles, fascia, and nerves. They see the external factors that cardiologists ignore. Neither side is completely wrong, but both see only part of the picture. The full truth is in the overlap. You can even test this for yourself. Sit upright, spine tall, head neutral. Feel your pulse at your neck. Then tilt your head forward 30 degrees and hold for a minute. Many people notice their pulse feels heavier or their head feels congested. That's venous outflow slowing down in real time. Straighten up again, breathe deeply, and you'll often feel a sense of relief within moments. What's fascinating is that Eastern traditions seem to understand this long before modern science. Yoga, Tai Chi, and Qigong have always emphasized posture, breathing, and gentle movement as a way to balance blood pressure. Modern studies now confirm that these practices do reduce hypertension. Could it be that these ancient disciplines were observing the same physiological truths that neurologists are now proving in research labs? It seems very likely. And so, the story of hypertension is no longer just about arteries and salt. It's about posture, nerves, veins, and muscles. It's about the way we sit, the way we move, and the way our body responds silently over years. We've seen how posture, nerves, and venous outflow can silently influence blood pressure. The question now is simple. If poor posture and weak or tense muscles contribute to hypertension, can we do something about it? The answer is yes, through careful relaxation and strengthening exercises that target the right muscles and restore balance. Before we begin, remember this is not about straining or forcing the body. The goal is gentle, controlled movement that reduces tension, improves venous drainage, and brings the neck back into its natural alignment. Let's start with relaxation. One of the most effective ways to release tension is with a simple roller. Lie down and place the roller at the base of your skull, right where the hairline meets the back of your head. This is the area where the occipital bone connects with the first vertebra. Slowly turn your head to the right and left. This gentle motion helps release the small suboccipital muscles that are often under constant strain. Continue this for about 5 minutes, allowing the muscles to soften and relax. From here, we move to the sternocleidomastoid muscles, the large muscles that run along the side of the neck from behind the ear down to the collarbone. To find them, turn your head slightly and they will become visible. Using your fingers, apply gentle downward pressure along the muscle, gliding toward the chest and then toward the collarbone. This helps release the fascia, improve mobility, and reduce adhesions that may have formed from years of tension. Work one side thoroughly, then switch to the other. Next, focus on the back edge of the sternocleidomastoid. Place your hands behind the muscle and gently pull it forward, then relax. Repeat this tightening and relaxing motion several times. Work your way higher toward the mastoid process behind the ear and lower toward the chest. The goal is not to press hard, but to encourage flexibility. Now let's address the scalene muscles, located just behind the sternocleidomastoid near the collarbone. With your fingers, trace the area down toward the top of the rib. These muscles are notorious for becoming shortened and tight, especially in people with forward head posture. When compressed, they can affect not only veins but also nerves running into the arms. Gently press and glide downward, releasing tension. If you feel a slight sensation radiating toward your ear, don't worry, that's normal. Switch sides and repeat. Once the sternocleidomastoid and scalenes are relaxed, it's time to stretch carefully. The wrong way is to pull the head aggressively or force the chin downward. This flattens the natural cervical curve and worsens instability. The correct method is subtle. Gently push your jaw forward and lift your chin slightly upward, as if reaching toward the ceiling. Stretch for a moment, then relax. Repeat several times. This not only stretches the tissues, but also improves lymphatic drainage in the neck. Now we strengthen the long neck extensors, the unsung heroes of posture. Lie on your back with a pillow under your head. Gently press your head into the pillow as if pushing backward, using only 30 to 40% of your strength. Hold for 5 seconds, then relax. Repeat several times. The key is to avoid pressing your chin into your chest. Instead, keep the natural alignment of the head and neck. This trains the deep flexors and extensors in harmony. For variety, you can turn your head slightly to one side and press back again. This engages the muscles more on one side than the other, helping correct imbalances. If one side feels weaker, do the same number of repetitions but allow for small breaks in between. Another useful variation involves lifting the shoulder blades slightly off the ground while pressing the head back. But this is only recommended for those without hypertension, as it can briefly increase pressure. For hypertensive patients, the simpler pillow press is more than enough. The lateral and anterior muscle groups also need attention. Lie on your side with your arm extended forward. With your nose, look toward your elbow. Slowly lift and lower your head. Repeat 10 times, then switch sides. This activates not only the neck but also the pectoral and shoulder stabilizers, all of which contribute to circulation in the upper body. Speaking of pectorals, the small pectoral muscle beneath the chest is another hidden culprit. Beneath it lies a vascular nerve bundle that can be compressed if the muscle is tight. To release it, place a tennis ball against the wall and lean into it, rolling gently over the area. Focus on tender spots and hold for about a minute, then continue moving. This massage helps restore freedom to the vessels and nerves beneath. Stretching the small pectoral is equally important. Stand in a doorway, place your hands low on either side, and gently lean forward, stretching the chest. Relax, then repeat with your hands higher up. This gradual stretch opens the chest and reduces compression on the bundle beneath. By combining these relaxation, stretching, and strengthening exercises, you restore the natural cervical curve, free up venous outflow, and reduce the irritation of sympathetic nerves. The body, freed from constant congestion, no longer needs to maintain artificially high blood pressure. It's important to understand that these exercises are not quick fixes. They must be practiced consistently, ideally daily, to retrain muscles and restore balance. But over time, the results can be profound. Patients often report not only improved blood pressure, but also fewer headaches, less fatigue, and better concentration. This approach also shifts the mindset of treatment. Instead of viewing hypertension only as a disease to suppress with pills, it becomes a condition we can influence with movement, posture, and awareness. Medications remain essential for many, but lifestyle interventions like these provide an additional path toward healing. The more closely we look, the the clearer it becomes. Hypertension is not just about what happens inside the arteries. It's also about what happens around them and how the nervous system interprets signals from those surrounding tissues. The autonomic nervous system is the invisible puppeteer of blood pressure. It consists of two branches: the sympathetic system, which raises pressure and prepares the body for action, and the parasympathetic system, which lowers pressure and promotes relaxation. Every artery, large and small, is wrapped in a web of sympathetic fibers. When these fibers are irritated, even slightly, they can trigger spasms in arteries throughout the body. This is why local disturbances in the neck can have global consequences. Irritated nerves around the vertebral artery don't just cause a stiff neck or headaches. They send signals that elevate pressure system-wide, as if a faulty thermostat in one room were controlling the entire building's heating system. But it isn't only about nerves. Several compression zones in the body can disrupt circulation and play a role in hypertension. The vertebral canal. The vertebral artery and vein travel through small bony openings in the cervical spine. If posture flattens the natural curve, these openings narrow. Venous outflow is reduced and irritation of surrounding nerves increases. The junction of the skull and first vertebra. At this critical gateway, venous drainage from the head can be easily disturbed. The result is a rise in intracranial pressure, which influences systemic blood pressure. Beneath the small pectoral muscle, here lies a bundle containing an artery, a vein, lymphatic vessels, and nerves. If the muscle shortens and tightens, it compresses this bundle, disturbing both circulation and nerve signals. In the legs, weakness in the calf muscles or spasms in the pectineus muscle can impair venous return from below, forcing the circulatory system to adjust upward. Each of these sites may seem small, but together they create a pattern of imbalances that raise blood pressure. This helps explain why some patients experience hypertension even when their arteries are clean, their kidneys are healthy, and their lifestyle is relatively balanced. The problem lies in the body's mechanics. Understanding this also helps explain why cardiologists often resist the idea. They are trained to look for intravascular causes, cholesterol plaques, narrowing, clotting. They see what's happening inside the pipes, but they often overlook what's pressing from outside: muscles, posture, fascia, and nerves. That is not their domain. Neurologists and physiotherapists, on the other hand, are trained to look at the body as a whole system of movement, alignment, and feedback loops. Neither specialty is wrong, but each sees only one side of the truth. And for the patient, what matters is not who is right, but what actually works. If addressing posture, venous outflow, and nerve irritation can lower blood pressure, then it deserves just as much attention as pills and diet. This also changes how we think about prevention. Instead of waiting for hypertension to appear and then medicating it, we can begin protecting circulation much earlier by preserving posture and keeping muscles balanced. Daily habits, how we sit, how we move, how often we take breaks, become powerful tools against disease. It is striking to notice that traditions like yoga and Tai Chi have for centuries movements that stretch the chest, strengthen the back, and keep the neck aligned are staples of these practices. Breathing techniques that calm the nervous system, gentle positions that improve venous return, all were developed long before modern science could explain them. Today, clinical studies confirm their benefits in lowering blood pressure. What ancient wisdom observed, modern physiology now proves. So, when we think about hypertension, we must stop treating it as a purely cardiovascular disease. It is also a neuromuscular and postural condition. The body does not separate these systems, they are intertwined. If one part falls out of balance, the rest follows. By understanding this, we unlock a more hopeful path. We are no longer powerless victims of numbers on a monitor. We can influence our pressure with awareness, movement, and consistent practice. We can work with our body instead of only relying on chemicals to suppress its signals. And this brings us to the bigger picture. Hypertension is often called a silent killer because it rarely causes symptoms until it's too late. But if we pay attention to the silent signals, tight muscles, forward head posture, daily fatigue, headaches, we can catch the problem earlier. These are the whispers of the body long before the shout of a stroke or heart attack. Now that we understand how posture, muscles, venous outflow, and the nervous system shape our blood pressure, the final question is, what can we actually do in daily life to protect ourselves? The answer lies in small, consistent actions. Hypertension doesn't develop overnight, and neither does recovery. But by paying attention to the way we sit, the way we hold our head, and the way we move, we can create real change. One of the most powerful tools is awareness. Notice how often your head drifts forward when you're on your phone, reading, or working at a desk. Each time you catch yourself, lift your head, roll your shoulders back, and let your chest open. This simple correction reduces strain on the veins and nerves of the neck. Next is movement. Our bodies were never designed to sit for hours in the same position. Every 30 to 40 minutes, stand up, stretch, or walk a little. Even a few minutes of gentle motion helps restore circulation. Strengthening the long extensors of the neck should become a daily ritual. The simple exercise of pressing your head gently into a pillow, holding and relaxing, builds endurance in the very muscles that protect your cervical curve and venous outflow. Pair this with stretching of the small pectoral and sternocleidomastoid muscles, and you create balance between front and back. Breathing also plays a role. Slow, deep breaths stimulate the parasympathetic system, calming the nerves that otherwise keep vessels tense. Just 5 minutes a day of relaxed breathing can lower pressure more effectively than many people realize. Lifestyle changes amplify these efforts. Reducing excess salt, avoiding chronic stress, and maintaining healthy weight remain important. But combined with posture correction and muscle training, their effect multiplies. Instead of treating hypertension as a one-dimensional enemy, you begin to approach it from all angles. This approach doesn't mean abandoning medication. For many, pills remain a necessary foundation. But it does mean giving your body extra tools that come without side effects, tools that restore natural balance instead of only masking symptoms. Over time, with medical supervision, some patients may even find they need fewer pills or lower doses. The beauty of this method is that it returns control to you. Instead of feeling trapped by a diagnosis, you become an active participant in your health. Each choice, how you sit, how you breathe, how you strengthen, becomes a way of telling your body, I am supporting you. And perhaps most importantly, this knowledge helps with prevention. Imagine how many young people today spend 10 hours bent over phones and laptops. If they learn early to protect their posture and keep their muscles balanced, they may never face the burden of hypertension later in life. Prevention begins with awareness, and awareness begins now. So friends, the truth about hypertension is larger than we were taught. It is not only a matter of stiff arteries and salt intake. It is also about muscles, nerves, posture, and the delicate balance of circulation. By combining the best of medical science with practical, body-focused care, we can change outcomes for millions of people. I invite you to test this for yourself. Measure your blood pressure before and after practicing some of the techniques we've discussed. Gentle relaxation, careful stretching, balanced strengthening. Write down the results. See how your body responds. The numbers may surprise you, and the experience may open your eyes to a new way of thinking about health. Hypertension may be common, but it does not have to be inevitable. With knowledge, practice, and consistent care, we can push back against it. The body is resilient, and when given the right conditions, it can find its balance again. So, let us not view high blood pressure only as a lifelong curse managed by pills. Let us also see it as a signal, a message from the body asking us to restore harmony. By listening, by adjusting, and by taking action, we can create real change. Take this knowledge with you, share it with others, and most importantly, apply it in your own life. Because the most powerful medicine is not just what comes in a bottle. It is the awareness and daily choices that keep our bodies in balance.